Well, Mike, you thought I wasn't going to toot my own horn, and you were right, but I think I accidentally had you and Gerard and Maggie do it for us, and then, of course, then to hear from the innovative stuff that Tobias described is really thanks to the panel. And we want to hear from the room. I do want to start with just one question. We just heard that maybe the response is a finance challenge, it's a communications challenge, and it's a supply chain challenge. So the question, Mike, for you, is the response also a public-private cooperation challenge? What is so hard about public-private cooperation? What makes it so hard? And what is your kind of, from WHO perspective and based on your experience, what is your approach to getting it right? And maybe to shine a light on why it's so hard to get right.
Yeah, we'll be here all night then. Yeah, well, beyond finance, communication, supply chain, people often ask me, what's the most important thing in public health and surveillance and fighting pandemics? And I often give them an answer: three things: governance, governance, and governance. I think we do forget that at the center of all this are governments and the people who are mandated to protect populations. The ultimate accountability in any society for the care and welfare of a population is an elected government. But within that framework, the private sector and the public sector interact. I don't see the difference. I mean, I go back to the mid-90s when huge amounts of we heard it yesterday, of fighting meningitis and yellow fever in Africa involved private sector providing proprietary information on their vaccine production across multiple companies to us, so we could effectively buy all the vaccine on the market at a preferred price and distribute it to all countries on the basis of epidemiologic need. At that time, any one of those companies could have probably sold that vaccine on the open market for 10 to 20 times what they were ultimately paid for. So I've seen through my career wonderful examples of people in the private sector doing incredible amounts of good work. And equally, I've seen plenty of examples in my time of people in the public sector running away from their responsibilities and doing bad things. So this isn't us or them. For me, someone used to this, we're all one family, we're all one society. I liked what you said. Business cannot succeed in a failed society. So I think there's a mutual interest here. We all have kids. We all want to go home and see them in the evening. We all want them to think of us as heroes, as people who do the right thing. But we do different things to do the right thing. You're right. I think WHO historically has been very nervous about private sector engagement, and understandably in many levels, because there are huge pitfalls, especially when it comes to pharmaceutical products. There are huge potential conflicts of interest. There are huge swamps that can swallow you very quickly in that. But knowing that there are areas where we have to be careful in the engagement doesn't mean we can't operate in the 95% of the territory that is safe to operate in. And I think that's incumbent upon us all to do that. I think, and I thank you for the comments everyone made, I think WHO and governments in general, it's not just WHO, are really beginning to realise that pandemic preparedness is a shared societal objective, and the private sector is an intimate, important and essential part of that preparedness. Some of the data presented by yourself, Margaret, on who trusts who, and that would have been a shocking statistic 10 years ago. No one is shocked by it anymore. And I've seen that. Pastoral leaders, community leaders, business leaders in many countries are often trusted more. So I think we have, as I said in my talk, there's a massive challenge. There's a real major project that needs to be achieved. I think reinsurance companies were the ones who led the way. I know Jim Kim had a survey done with you a couple of years ago that looked at what were the greatest risks to society over the next 20 years, and I think epidemics and pandemics came right to the top of that list. So if we accept the collective risk, then we accept the collective challenge of managing it. Turning that in, though, and this is the thing, transforming that common purpose into real solutions, real funded, sustainable solutions that aren't just flags to be waved by others, that don't just turn into pork barrel funding of stuff that looks nice but doesn't deliver. That ability to be disciplined and truly cooperate, not just deliver what we think you need. And I've had situations in the field, clearly, and I have to say it, with private sector people arriving with boatloads of donations that were utterly useless to what was needed. And what was being looked for was a yellow ribbon moment. Cut the yellow ribbon, get the photo, get out of Dodge. Right. I think it's much more sophisticated, much more mature now. So this idea of a sustained, coordinated investment, where we all leave our guns at the door, and try and do something practical with some serious practical outcomes. And I'd love to see. That's why, and you're asked why we've very much engaged with your process led by yourself, Ryan, is that we see practical things coming out of the Readiness Accelerator. They're not earth-shatteringly important in the great scheme of things, potentially, but they're real stuff that can be delivered in a time frame that's doable, and with not tremendous amounts of funding either needed to make them happen. So, and I hope we'll have a few announcements for next year, Davos as well, so some innovative stuff we're going to do together.
Thank you, Mike. I do have questions for the panel, but we do want to hear from the group, and so let's go to the floor. Hannes.
Thank you, Ryan. Thank you all for being here as well. It's good to sort of see private sector representation at a meeting like this. We talk often about the lives impact of outbreaks, but there's also the livelihoods impact as well, which is substantial. And what people often forget, actually, and miss, is that much of the economic damage that's done by these outbreaks disproportionately affects the already most vulnerable groups around the world, so the already marginalised. So it's great to see that we're now being more collaborative about this. Tobias, it's great to hear you speak. Financing and solving some of these financing challenges, clearly a really big part of it, and the PEF is a useful adjunct in that landscape. You talked about sort of other types of funding that might be available as well, and one of the things that I've been thinking about recently is whether there might be other insurance-type interventions that might work below the country level. The great thing about the PEF is that it's a World Bank-backed initiative that provides funding for countries who aren't necessarily choosing to pay the premium. It's the collective community choosing to pay the premium. But we know that historically, when it comes to things like insurance, governments, companies, individuals tend to underinsure. And that drives one of these cycles of panic and neglect in terms of financing and flows. Could you share any thoughts that you have had about sort of how we might address that, and whether there's scope for financial innovation sort of targeted at things other than countries?
Am I on?
Yeah.
Okay. Thank you. Very good question. It also allows me to react to your first question about some of the challenges. So, I guess wearing my salesman hat, I would say, look, if somebody wants to buy insurance, say, instead of at their supranational level, like the World Bank did, but at the national level, then they could. The Pandemic Emergency Financing Facility shows that you can tailor such a product. And you certainly could, for example, initially there was thinking, does a country, or does a donor, let's say, want to buy top-up insurance for a specific country that they, because it fits into their collaboration, or because that country's primarily exposed and so forth. And so the major challenge to that I see, and a country could buy that for a certain district, or for a region within its territory or something like that. The major challenge that I see is that the proposition of buying market-based financing is really alien to the public sector, and I get it, I understand it. So this idea that I want to just make sure. So we provided the service to the World Bank, who are the buyer of this insurance, and they were able to afford it with assistance from a few donors, including from the IDA fund, by the way, the fund for the poorest country within the World Bank. And as I observed that debate, should it be renewed? Should we start preparing for when this policy runs out? And in 2020, do we need to start working on the next coverage and so forth? I observed that the challenges that are being worked through are not on the technical side, not on designing better coverages, better indexes to capture the risk and so forth. Certainly there's a ton of work to be made in that. But it's more about, does this provide value for money for public sector? Because the idea that you will have paid premium to, let's face it, big finance, right? So the risk takers here, these investment funds that invest in this is Wall Street. The idea that public donor funds end up in their pockets and there is no triggering event over the period of that just scares public officials like crazy. And you can look at that in a number of ways. I mean, think about your health insurance, right? In a sense, the best outcome is that you pay premium every year and you never use it because that means you never got sick. But people have different views of that. Certainly in the public sector, I think the idea that there is no triggering event, what they really hope for is a triggering event that doesn't really hurt anyone, but that they get as much back as they paid premium, which is a little bit absurd. But I don't mean to belittle this conversation at all, but I think it illustrates to how innovative this really is, largely from their perspective. This idea that you would pay capital even if the benefits, at least the potential benefits of an early trigger of having this leverage where you pay a certain amount of premium, but if it ever triggers, you get a much larger benefit out of it. Even if that is recognized, I think the main obstacle is kind of this idea that public funds end up in private pockets.
Can I just ask a follow-up?
Sure.
I'm sorry.
Sure.
What if there are too many triggering events?
Yeah.
What does that do to private sector appetite to provide that?
So we're back to the intricacies of the product a little bit. So there's a model that was designed by a third-party vendor modeling agency that does this type of stuff for the insurance industry, and it works with flights and passenger movements and seasonalities and a gazillion different factors, and then it comes up with a curve that essentially puts in a relationship the probability and the severity of the outbreak. A sort of a loss frequency curve, we call that. And then whoever wants to buy such a product basically decides, well, what is the attachment level at which you want to buy your insurance? And so if you buy something that the model predicts will trigger once in, every 5 years, then whoever takes this risk is going to say, well, I'm going to need a lot of premium to cover that. If you get something that has a probability of triggering once in every 100 years, then every Minister of Health is going to say, well, I got tons of stuff to do until this thing triggers, so this is not a priority anymore. And so that's where you have this trade-off between how urgent or how often do you want it to trigger, how much premium are you willing to pay for something like this, and how high up on the list of priorities is this really among all the different things that you need to consider. And so I would say it's a price question. If you want it to trigger every year, then we're swapping money, right? I'm going to ask you so much premium as I expect to pay out to you. So that's not an interest anyone. This I can share that the PEF has different tranches and so forth, but it's basically designed to trigger has a 5 to 10% probability of triggering every year. So that was essentially, that's the buyer who decides that, right? It's a bit like you're choosing your deductible or your copay.
I have a closely correlated question, sort of the other side of that question, which is you have a room full of people who are interested in mitigating those triggering events. So when you think about these public-private partnerships or collaborations, how can these organizations collaborate to reduce the premium so that the organizations purchasing the insurance actually pay less? Because that's something we'd all want to do.
Yeah, I might take the next two.
Sure.
I was just noticing the time. I thought maybe take the next two questions as well, and then we'll take them all together, if that's okay. Tobias, sorry.
Yeah.
Yes, thank you for the panel. My question is the internal process of the get legitimacy inside with the WHO. In the case of multi-drug resistant sclerosis, WHO endorsed the very novel drug sensitivity test. This is produced by private-public partnerships in Europe, in Belgium, and in I think this is Netherlands, and it is quite great. I think it's great, but I wonder what was the internal process to get legitimacy inside of the WHO? And I wonder, it is because I'm very fascinated by it.
Thank you.
Hi. So
Question?
I'm very interested in this insurance thing because, it hinges on thresholds where you have to believe your probability. 5% probability. In my world, that doesn't mean anything because infectious disease outbreaks, defining what that means, you can throw in airline data, you can throw in all this stuff. The models are not very good, and the uncertainty is huge, and these are rare events that start small and can look mild and whatever else. And so I wonder, you said in your talk, if you believe the model, then you're willing to buy the insurance. But, I don't believe the model at all, right? And I think a lot of infectious disease epidemiologists would look at these giant simulation models and say, this is nonsense. We don't know how people are moving around Sierra Leone. We don't know, any of the underlying parameters of the model. So your confidence intervals are enormous around that probability. And for any trigger that's a go, no-go decision, I wonder how governments and how we as a community interested in doing this better can think about communication of those uncertainties in an honest way so that what happens is people lose trust in the whole concept.
Could I maybe address part of that, because your point is well made. If you look at the cash window of the PEF, it's not triggered by the model. It's actually triggered within a group within WHO, a scientific technical advisory committee with people like David Heyman and as a
and
chair.
Those triggers are more...
And the data is presented to a learning group, and it's a hive mind. And the decision is made regarding the public health importance of the event and the need for a response. So I think over time, as the instruments develop, there's going to be different layers within it. But you're absolutely correct. But you have to start somewhere. And the issue here has been, how do we get the private sector to participate in indemnifying the risk associated with with disasters as such? And within that, there may also be ways to have incentives in that for preparedness. Because if countries, for example, already within the PEF, there is this concept being developed that countries who engage, for example, in implementing 5-year national action plans for strengthening their own capacity across the 13 different core capacities, that if countries invest in those capacities, that there are donor countries willing to pay premiums and willing to reward those countries within the PEF for having done so. So there is a way. I don't think we're there yet. I don't think we've reached the best instrument, and for example, while it may be a very large fund, in a true pandemic, it'll be gone in 5 days. I mean, that's just the reality. So this is the first attempt to create an instrument that in some way tries to manage risk with a payout, tries to incentivize preparedness and having governments think through the issues, as you were saying, Tobias. And we, I think, can begin with you and others to see, can we come up with better models? Can we come up with better predictive analytics to look at impact and everything else? But like everything else in Ireland, when you ask for directions, usually people say, well, you know what, if I was going there, I wouldn't start from here, you know? And we have to be very careful, because it's very easy to say, well, if I was doing that, I wouldn't start from there. It has started, it exists. We have seen the cash window triggered for the last Ebola outbreak very successfully. There are issues through the whole system, but I'm not here to defend. We're advisors to it, but I think it's important to recognise that it's a good first step. But your points are well made. We have an awful lot more work to do to adapt these instruments, both for the private sector investors and for the public sector users of those funds when they get triggered.
I think so a couple of comments. You raised excellent points. Don't trust the model would be my advice. But one of the benefits that it does have is that you obviously have historical records of outbreaks. And so once you have that model, you kind of back test it, you apply it, and then you can sort of determine when would it have triggered in the past. And so for the PEF, as far as I know, for some of the pathogens, they went back, hundreds of years. Obviously, the WHO wasn't reporting, didn't produce Citreps and Dons and stuff at the time, but nonetheless, so that's a bit of an assumption when those would have been reported. Other than that, you're right. There is, it's called basis risk. In other words, there is an event, but it's not captured by the parameters that you have selected. And so that is why there are different sources of funding that were put in place. That the cash window that Michael refers to has activation criteria. They're called. Now those, I'm sure they're written down somewhere, but I'm also pretty sure you can negotiate them. So that provides a lot more flexibility over that larger layer of insurance where you can't really negotiate. Having said that, there was always a big discussion when this was placed. You know, say you have you've agreed on 250 reported deaths of a certain pathogen. What if it's 249? So this thing doesn't trigger, and you know the world has a big problem. It wouldn't. If you, because this is, you know, it's like a security and there is 300 pages of documentation. So, but that would be an uncomfortable situation, I think, for all sides. Regarding the question about mitigation and prevention, obviously, you know, the World Bank will be the first to tell you that whether it's natural disasters or disease outbreaks, prevention and mitigation is what comes upstream before you think about financing. You don't finance from the first dollar, right? You don't finance just as you have a deductible for your car. You know, if you have to absorb a certain risk, and you have to mitigate that risk by being a good driver, and by, you know, this is why we insist on having people having to have a driver's license and doing car training and driver training and so forth. Would such measures actually trickle down into smaller premiums at a country level, at a global level? I mean, you'd have to have a pretty detailed model to capture that. I mean, let's assume, so there are some Ebola vaccines out now. Let's assume the whole world is vaccinated. Yeah, then sure, the probability of a huge outbreak, it stands to reason that will be lower. So therefore, you know, the premium would go down. But you know, if certain districts, let's say in a country that is still overall very ill prepared, you know, are making certain improvements, again, do you have the model to really capture the improvement, the resilience of that country at that granularity, and that it then translates into lower premiums? I think we're not quite there yet.
Getting there.
One of the things, Tobias, that you had mentioned was the challenge in the onset was on almost a philosophical challenge with public sector paying private sector premiums to a private sector company. I wonder if we find the same types of challenges in other areas, and I'll turn to you, Gerard, and then to Maggie. If in many ways, and because I put you on the spot, I'll lead you a little bit, Gerard. When it comes to supply chain, some of the answers aren't that hard. But rather, there's a conversation that we've had to have, and you've been having, over some time on some of those philosophical issues. I wonder if you could shine some light on them and what that process has been like and why it's so important.
Sure, happy to do so. Mike Ryan used an important term not so long ago, governance, and that has been a large part of what we've been discussing over the past few years. As I indicated in my earlier remarks, the private sector and the WHO hadn't always had the fruitful relationship that we have now, and part of the reason we are where we are now is we've just gotten to understand what's important to each party. And speaking for myself, but also for the pandemic supply chain network, we have a much more acute understanding now of the political challenges that the WHO manages on a daily basis and why governance is so important. Mike also made an interesting point, and there's no denying it, that there have been instances where the private sector donates product because it's beneficial to the private sector, but may not be beneficial to the recipient, right? And so the beauty of governance, particularly these disease commodity packages, is we know exactly what the community will need in a time of crisis because it's there in black and white on paper. We know the products, we know the amounts, and now we can map against that. So that's an example of how governance will allow us to keep each other honest, right? And in doing so, allow us to advance a relationship perhaps in a way that wouldn't have been possible in years past. And so that's why we're optimistic. That said, all of these things are easier said than done. I mentioned customs regulations. One would think that a glove and a gown and a mask is such a basic item that there wouldn't be any kind of challenge from country to country in terms of customs and moving it into the country. But you'd be surprised, right? And so one of the things that makes this more complex than it needs to be is varying degrees of regulation and inconsistent standards across countries and organizations. And so to the extent that we can begin to break that down, again, for basic items, we will have done the world a service.
Go ahead.
So I think in terms of communications, it's actually making it easier. I don't think it's necessarily complex. I think most of the companies that we work with, the very large-scale multinational corporations, they know what to do in terms of a recall, product recall, or if they have a supply chain issue. They have very sophisticated crisis plans in place and business continuity plans in place. But when it comes to something, again, recognizing that fear can be as disruptive to the business as a supply chain disruption is something new and different, and it's a different level of communications. When you have to talk to your employees and you have to reassure them that if there's an epidemic, that you're well prepared to manage it, you'll safeguard their health, you'll watch out for their families. It's a very, very different kind of approach, which is why I'm very pleased to be part of the working group, because if we can put that into a toolkit and really help company communicators have a go-to resource that really will help them manage the very scary aspects of an epidemic, but doing it in a way that's meaningful company to or country to country to country, I think we can make it easier. And I think then people will be more receptive for playing a larger role. Because they can do it from a business continuity, they just aren't doing it yet from communications through the employees into the communities.
Thank you, Maggie. We'll take it back to the floor.
Yeah. Okay. So hi, I'm part of the firm that developed the models for the PEF, so I felt I'm responsible to defend the models that we built. I just wanted to mention two things. First is that, as it has been mentioned before, the model, the responsibility of the model is helping the decision makers to make a better and more informed decision. By no means the model is going to say the accurate number of the cases or deaths that we may see in the next epidemic or pandemic or whatever. But if you think about the goal that we all are pursuing, which is reducing the the economic loss, reducing the number of deaths in the pandemics that we are going to observe, so the models try to help us to put us in a narrower path, which helps us to reduce the risk, and it gets help from the historical events. Also, the feasibility of the emerging outbreaks and pandemics by knowing the characteristics of the pandemics. We know that we may have disease X, that we don't know anything about it, but with whatever information we have, with the new technologies that we have, with the computational capability that we have access to, the models are capable in helping us. I mean, I used to be with the public sector. Now I happen to work with the private sector. And what I observe is that I don't know why people are very conservative. I really appreciate the expert opinion, but why don't we use these new technologies when we want to make decisions, which comes from the mathematics, geographical sciences, the epidemiological sciences, computations? I think if we think about the goal that we all are following, using everything, all the tools that we have in hand is going to be beneficial. It can be model, it can be surveillance, it can be better surveys, whatever we have. So I just wanted to say that try to be open to the new technologies that we have access to. So thank you.
Ryan?
Sure, Mike.
Just on this, because if you pull together the wonderful panel that happened before this panel around data and all of that, and we think about the data and innovation package that's within the Epidemic Readiness Accelerator, recent engagements we've had with the Ending Pandemics Collective and some major foundations like Wellcome and Gates, there is a huge appetite both in the private and public sector to advance this whole area of forecasting, predictive analytics, modeling and all of that. But as Charlotte said, it's an area in which there's going to have to be a huge investment Because it's not just about the artificial intelligence engines, it's about the data that's mined, it's about ownership of that data, it's about a whole range of issues that are both regulatory, they're about privacy, and remember, we're all sitting here in North America. There are other stakeholders around the world, in China, in Malaysia, in India, the real engines, to be quite frank with you all. And the people we're having the biggest discussions with are in China and in India right now when it comes to data analytics, predictive analytics, artificial and augmented intelligence. Quite frankly, they're ahead of the game. So this is a very skewed conversation in a very limited environment right now. But there needs to be a huge step forward in that area. But I think this is where the WEF and the private sector have the capacity to bring the investment, to bring the knowledge, and to work with the academic institutions in particular who've been shining the way and shining the light on the path here, and then the usefulness of that for organizations like WHO and government. So can we put all this together? And I think that this conversation has been about today is how do we leverage the knowledge, the skills, the passion, the capacities and the investment capacities of all of the institutions across the public and private sector for some grand projects. Some of that's going to be around developing new drugs and vaccines. Some of that's going to be around developing new financial instruments to fund preparedness and response. Some of that's going to be around new data and IT innovations for data capture, data transfer, data analytics. And that's what I would like to see coming out of meetings like this, is we take that big next step, like you're saying, to stop being afraid of embracing these big ideas, and in the area of pandemic preparedness, take 3 or 4 big ideas and actually make something practical come out the other end. Like we've been talking to Gerard here. If you're in the field today in Congo, it's not the epidemiology that's difficult. It's the security. It's keeping 280 people alive in the deep field and supplying them with food and with vehicles and with security officers and with flights and with minus 80-degree vaccine and with coolers and with protective gear and all of this other stuff. It's 90% a logistics operation, 10% a science operation. It's a big hammer driving a very sharp nail. But without that big hammer, nothing works. And if we have a pandemic tomorrow, I guarantee you, it won't be a failure of science that will stop us responding to the pandemic. It will be a collapse of our ability to supply the people in the front line and our own communities. So for me, I think the issue for us is look at supply chain, look at data innovation, look at financial instruments, look at communications, look at data analytics, and see can we collectively come up with some big ideas. And for once, private and public sector get behind those ideas for long enough to make a difference. And I would just, I don't know, I'm being passionate about it now, but that has to happen. Because the prospect, we're not talking about the next epidemic with 100 cases. We're talking about the next pandemic, potentially where millions of people will die and our economy and our societies may actually just stop. And what is it worth? And what are we prepared to invest as a public and private sector to stop that or mitigate the impact of that? And I don't even think we're at the races yet when we're talking about the scale of investment we need to make that happen.
And I would just add to that, one of the particular items of great interest to us in the private sector on the supply chain side, and this may be wishful thinking, but we would love to have some kind of early warning system, because it takes time to get raw material, turn it into finished product, and get it shipped to a location. And so if the world turns to us when the outbreak is already raging, it's way too late by then. And so the sooner we know that there is something brewing, recognizing that the data is nowhere near being perfect, in a way, of course, that from a communication standpoint doesn't result in panic either, we can begin doing all of the work that we do to accelerate the supply chain. To Mike's point, that is such a critical item that tends to be overlooked until until it breaks.
I'm mindful of the time, but let's do one more question.
Just one quick
question. Yeah, no, we need to.
Well, actually, it should have ended on that impassioned speech, and that's awesome. I just want to sort of hop in to say, I know that this is a 1.0 version of this insurance mechanism that's coming, but is there any conversation about how it might be used as an incentive for, let's say we know, logging companies that log and then expose surrounding communities to new vectors, or maybe even the arms suppliers for belligerent groups in the DRC. All of those companies and private sector actors are actually increasing the risk of emerging epidemics. Is there any sort of thought of using insurance eventually as a tool to require or compel them to pay into a fund when their actions in the field are increasing the chances of an epidemic or outbreak?
Well, I certainly can understand the background or the reason for you asking that question. I think that's a regulatory or that's somehow a policy decision that somebody would have to take if you engage in this economic activity or in this illicit activity, and this is the penalty you will face, or this is the cost that you have to contribute to the externalities that you're causing. It's not really a contingent financing proposition, so it doesn't lend itself well to insurance, because it's like rust. It'll happen. If you don't want it, you need to clean your bike. And so it's not something where you have insurers call it, it's sort of, there's no element of randomness in that, if you will. If you know that if you're, the causality is there, basically. It might not be so linear or not so direct, but no one's going to sort of take the risk on that and say, I'll insure that. I'll insure, this mining company destroying the rainforest somewhere. Well, no, because they're doing it. We know it's going to happen. So there's no, it doesn't lend itself to a transaction, if you will, like that. Other problems are a bit different. For example, the World Bank is now working on a famine response mechanism or at least trying to see if that could also be possible for international response to famine situations.
Okay. With that, I think we'll thank our panelists, and thanks for the questions, and we'll move on to the next session. Thank you, Shana.
Very much.